All right, I'm Hayes, and this is Mark Welch. Thanks, Mark, for being here.
Hayes, I appreciate the opportunity.
Absolutely. Well, I'm happy to have you here. Mark is the Senior VP of Supply Chain at Novant Health, which is based in North Carolina, but they've got facilities in North Carolina, Virginia, South Carolina, and Georgia, a very large, very complex system, roughly $5 billion, 1,600 employee docs. It's a big system. And so thank you for being on here. And I have a couple of questions for you today, Mark.
Great.
My first question is going to be, what has the impact of COVID been to your system, and maybe have things become to somewhat stabilize?
Yeah, that's a great question. And Hayes, if you think about it, it's probably the same impact at all large systems, small systems, community systems. It ended up being a challenge, and a challenge we had to meet up and solve quickly. So like everybody else, we saw the headwinds coming. I mean, it's coming. It just kind of swept across the world. So we did start preparing kind of early, quite early actually in January, like a lot of other large systems with information and data and analytics. So we're very fortunate that we do have a strong analytics team, and we know what we use, where we use it, when we use it, and we also have a central distribution system. So that helped us, enabled us that we weren't just throwing out orders all over the world and getting from one hospital and competing and wondering where stuff is going. We're able to put our system on allocation probably early February and started talking conservation with our clinicians. Our clinicians come to our rescue, I would say, and the fact that they started building protocols on when an N95 should be used, and so people didn't, panic and say, "I need an N95 for everything, from front desk to garbage removal and environmental services." They actually went through and laid out for us a very strong structure of when you use different PPE for different reasons. And I think because of that, we didn't have a run on our inventory. And so our inventory was able to build up until the point where we started hitting our surge for us in late April. And we were able to maintain that and get through the early crisis without a lot of scars.
That's fantastic. And so you answered kind of the question about protocols and things. Can you maybe identify one particular bright spot? Maybe it's a department within, inside the system. Maybe it's a company, anything that stood out that, that you're like, man, that was fantastic.
Well, I think our relationship with our infection control and quality and safety, Dr. David Priest and his team really stepped up. Because we had to look at some alternative products, and we had to look at them fairly quickly. And one thing we want to make sure is we're not buying products that we're not safe and we're able to use in the hospital system. And their reaction time was phenomenal. They actually would come down to our warehouse, we'd go through products, they would test it, they would read all the literature that we had on it, and they would deem it worthy or not worthy. So that was a great learning curve for us. The other thing is, I think we're very fortunate in how our system reacted, and it wasn't by accident. So building that clinical relationship that we have over the last 7 years has come tenfold for us. If I were in the situation in January and February, trying to figure out who my clinical leaders are, my CMO, if I didn't know his name, or if I had to introduce myself and asking for help, or my chief nursing officer, Denise Mehall, if I had asked her, what do you do? How can you help us? It was automatic. It was a simple text. Here's where we are. How should we approach this? And of course, with the beauty of Zoom, like we're on today, we move pretty quickly. And so being in front of it, and then having the opportunity with our executive team early on. And like I've said before, supply chains, we want to be at the table. We have a lot of great skill sets in our team. Logistics, it's all about that. We have a lot of great analytics, but getting to the table and not having something to offer would not have kept us at the table. So we're very fortunate that our system responded well to us, from our CEO to our frontline staff. We've really established and got a great exposure and delivered on that. So I think it's important that we did deliver on that. And I think going forward, we hope that we will continue to be one of those go-to departments.
Well, you clearly have a great reputation internally. I do know that. And so it's great to have, leadership that recognizes it. And like you said, I think across the board, supply chain has risen in most health systems now. It's the importance is seen by everybody. Any changes that you see maybe as we move forward on your warehousing strategy or stockpiling? What do you see there?
So, we've got a pretty good strategy as far as surplus and safety stock and things, but we did add another 50,000 square feet because of this. We had to lease another space just to make sure we're including food storage. I mean, that's something that we didn't typically store before. So now we got some food storage things going on. We've worked well with the pharmacy. Pharmacy's been doing a great job within our system, very similar to supply chain. They didn't run out of anything. So their preparation was top notch. I do think there's going to be changes going forward. I'm not going to be one to go build another 200,000 square foot facility and just fill it up with stuff. You've got to be practical about this. One is that the capital investment to do that would be significant. But also, if you think about inventory turns, if in the past, if you use 100,000 N95s, now you got 1 million on hand, it's going to take you 10 years to turn that over. So you don't want to have the inventory sitting around going stale, and it's going to be almost impossible. So I think it's going to be a combination of having the right amount of inventory that will take you through any bolus situation or any surge situation, as well as recognizes when those surges are coming and having the right relationship with our manufacturers. So maybe integrating a little bit more with our manufacturers and making bigger commitments to them, or maybe even investing with them. It might be idle product lines. It might be where they can produce this much by this much date, with the right notice, transparency, letting them know what we have, let me know what's coming up. So I think that, along with the right onshoring, I don't think we'll ever say we're going to make everything in the United States, although that would be wonderful. But I think long term that would hurt, not only us, it would hurt everybody. So we're going to do a combination, Hayes, of onshoring, nearshoring, offshoring, and kind of blend those. And I know those are 3 different price points. So as we look at those price points, what's the correct amount that we're willing to pay and be able to sustain for the next 6 to 10 years, versus we get through the crisis and we all forget what happened. So we can't go back. We can't go back and expect that everything's going to be fairly cheap on some of this PPE stuff. We've got to pay the right price for it. We got to make it profitable for our partners that's producing these items. And then we got to find out where in our systems we can eliminate waste so we can make sure we can afford this going forward, because it can't be something we can just pass on. So it's going to be
I was just going to say, these are conversations that you've really never had in the past. It's all new stuff. So it's a lot of changes coming forward, aren't they?
Definitely. We've had some of these conversations in the past, but this has really exposed the conversations and the support that we're having from our hospital system, and the willingness to have the conversations on what that investment may or may not look like. It is more palatable now. So people are more willing to listen and say, we got to figure this out, because this is not going to happen to us again.
Exactly. Mark, thank you so much. This is fantastic information. I appreciate you doing this, and keep up the great work, and we'll be in touch. Okay.
Thanks, Hayes. Have a good day.
All right.